With us now is the Vice Chairman of Gateway for Cancer Research, Dr. Stacy Stevenson. Dr. Stevenson, welcome to the show. Good morning.
Thank you, Hannah. Happy to be here.
Currently, we know 1 in 8 women will be diagnosed with breast cancer. We were talking about this during our meeting. We all know someone that was affected by this disease. But what has changed since 1985?
Well, what's changed is we understand prevention so much more. We have immunogenetics, we have new therapies. But what's sad is that the rates are actually increasing, but survival is increasing as well. So there's good news with the bad news, but overall it's a positive trend.
Why is the number growing of women being diagnosed with breast cancer?
There are a lot of studies evaluating that right now. We do know that nutritional deficiencies impact greatly. We know that toxicity impacts substantially. We do know that there are more cases under age 50 now than there ever used to be. So that looks more and more environmentally linked. We also have better methods of detection. I mean, there's a truth to that earlier stages are detected, therefore it increases the overall case rate, but that doesn't mean to ignore that. Overall, the total increase is probably substantially environmentally driven, hormonally driven. Hormone and chemicals in the environments are triggering those genes to turn on and your immune system to reduce its surveillance.
So a lot of factors here, but like you mentioned, technology is getting better. Researchers at the American Cancer Society found by 2035, the number of breast cancer survivors will be more than 5 million. That's great. That's a high number. But talk to me about the different type of treatments available to breast cancer patients.
It is a very high number. There are, the basic treatments still are available to all of us, and that's surgery, radiation, chemotherapy. Those have all been around for 30, 40 years. But the exciting emerging fields of immunotherapy are very substantial, and they're also individualized to your unique cancer. So that's the new piece. We used to have to treat people just sort of a one-size-fits-all. But now we're treating people with multidimensional approaches, tailored therapies to your unique immune system, to your unique cancer. And that's the exciting piece that's really occurring, the individualized therapy.
We've been excited to talk to you because you work in developing groundbreaking trials for cancer treatments. You mentioned the immunotherapy. Share with me what else you have in the works or part of immunotherapy and how it works.
Well, I love some of these other connections and studies that are out. Vitamin D for prevention of breast cancer is very critical. Actually, vitamin D is critical in all cancers. And let's not forget about men in breast cancer, even though we think about ladies only right now in Breast Cancer Awareness Month. Utilizing vitamin C for pre-treatment in chemotherapy can ease the symptomology, move you through much more smoothly. Obesity and reducing obesity is an enormous prevention in our arsenal, and overall rates of obesity are gradually beginning to decline, even though it's a big battle. But don't forget about the basics: your exercise, your nutrition, your diet, and also looking into your genetics. And if I could say one thing about genetics and looking at your family, please don't be too calm if you don't have breast cancer in your family. Still get all of your screenings, get your mammograms, stay on top of things. Don't be afraid to ask questions. Many cases arise from those with no family history. So don't be too calm about that. Just keep getting your screenings and your evaluations.
Yeah, I've had several friends who have no history of breast cancer in their family, but somehow got the disease. Now, you and I are talking about these advances. The CDC says the 5-year survival rate following a diagnosis of breast cancer is more than 91%. Again, huge decrease from a few decades ago. You and I are talking about Breast Cancer Awareness Month. It's a time to highlight the screenings and mammograms that you mentioned a moment ago. The question that many are wondering, because the age, I feel, keeps on moving, when should women start to get screenings? It used to be 50. I believe it's 40 now. What is the right time?
In my heart, I would say to you 35. 40 is the official party line, let's say, but honestly, I don't see any concern at age 35. Getting baseline is very smart. Getting the understanding, beginning to educate yourself earlier rather than the magic number of 40. And certainly just to calm your thoughts and calm anxieties. If it's something that you feel you want to do and you want to understand your health better, there's truly nothing wrong with that. Prevention is key. Early detection is incredibly key. You're going to go through less treatment, less evaluation. And I also want to say that regarding mammograms, I'm an integrative medicine physician at heart and soul. And there are therapies out there or detection methods that people say, oh, don't get mammograms, don't get this, don't get that. Please, and I'm saying it from as a clinical nutritionist as well, get all of your traditional screenings. There are other opportunities out there. Thermography, for example, there's not necessarily anything wrong with it, but please just get your traditional mammograms, get them beginning between age 35 and 40, and stick with it. And don't be scared that there are some false positives. There are further evaluations that can take a little bit more time, but give you peace of mind, and just stay on track and do it for yourself.
If there is history of breast cancer in the family, should women get screened earlier?
You need to understand what types of breast cancer were in your family. So the short answer for me, if you're just asking me personally, would be yes. And generally, as physicians, we also say yes. If it is in your family, you probably do want to start a little bit sooner, but it's better if you understand the exact types of cancer that affected your family. And when we say family, I want to be very clear there. It really is only what we call first-degree relatives, which is mom and sisters. Those are your closest relatives. You don't need to worry about your second and third cousin and, your great, great, great aunts and things like that from a breast cancer perspective. Look to your nearest female relatives.
I want to go back to something you said, that breast cancer rates are on the rise when it comes to young women. It's also one of the leading causes of cancer death in women ages 20 to 49. That is very young. What symptoms should they be on the lookout for?
Well, here's what's scary about breast cancer. There generally are not symptoms. It's very silent. Now, there can be very subtle signs, changes in your skin, changes in nipple, lumps. We all know, self-evaluation has saved a lot of lives, so keep that up as well. But pain is not typically a symptom. So if you find something suspicious in your breast and it is not painful, don't assume one direction or other, okay? Always get checked, pain or otherwise. I think there's a misconception that pain probably means there's cancer. It's actually the other way. Many times there is no discomfort or pain when you feel the unusual lumps, bumps, nipple changes, discharges, things like that. You need to have checked out right away, and don't just use pain as a threshold.
I've learned a lot from our conversation. I have no doubt others have as well. Dr. Stacy Stevenson, thank you for your time today.